have with us Head of Communicable Disease Branch of the Center for Health Protection, Dr. Chang Shuk Kwan, and Chief Manager of the Hospital Authority, Dr. Sarah Ho. We'll first hear from Dr. Chang. Good afternoon. We have from our public lab together with the Hospital Authority confirmed 4,285 cases, about 1,000 of them samples directly confirmed by the HA, and about 3,200 cases were verified after reconfirmation by CHP public lab. In relation to the 3,200 samples handled by CHP, 48 of them carry L45R, 452R, and 3,138 cases carry negative result of L452R, and about 40 samples or so that have got an insufficient sample load or is not yet confirmed, and about 1,055 were handled by the HA. And of the 4,000 or so cases, there are 21 cases that are imported cases. We have about 7,000 preliminary positive cases on hand. For our public lab, for samples from the day before yesterday, there are about 1,200 samples were waiting to be processed. About 7,000 preliminary positive cases. There are some samples that were waiting to be sent by private clinics to the CHP. We asked private labs to send these samples to the CHP for verification. I think it's a considerable number. After our report yesterday, about 20 residential care homes and homes for people with disabilities have confirmed cases, preliminary cases, or RAT positive cases of residents as well as staff members. I'm not going to go into details. We follow up on a number of these cases. We'll now hear from Dr. Sarah Ho. There are about 2,654 confirmed cases and preliminary positive cases that are staying at various hospitals, at the North Lantau Hospital, Infection Control Center, the Infection Control Center of HAs, as well as the facilities at Asia World Expo. There are about 2,000 patients that are staying at the Penny's Bay Community Isolation Facilities, where there are 17 confirmed cases, patients that are in a critical condition. In the past day, there are 238 patients that have recovered and been discharged. 9 patients passed away, including 182 female patient who died at Caritas Hospital at 3:45 p.m. The second one is an 100-year-old female patient at 8:01 p.m. yesterday, passed away at Chuan Kwan O Hospital. The third one is a 3-year-old girl at 8:37 p.m. She passed away at the Children's Hospital. The fourth one is a 72 male patient at 10:14 p.m. He passed away at the Queen Elizabeth Hospital. The fifth one is a 90-year-old female patient at 10:17 p.m. She passed away from the Eastern Hospital. The other one is a 75-year-old female patient who passed away at 11:07 p.m. At the United Christian Hospital. The seventh patient is a 97-year-old male patient who passed away at 2:26 a.m. at Queen Mary Hospital. The other one is a 97-year-old female patient who passed away at Queen Elizabeth Hospital at 5:55 a.m. The ninth patient is a 37 male patient who passed away at 9:53 a.m. at the Eastern Hospital. In relation to these cases, we feel sad, and we will provide assistance to surviving family members. So far, 224 patients who are confirmed or preliminary positive cases who have passed away from public hospitals. For isolation beds, the utilization rate is over 90%, which is the upper limit. We've learned from the news that patients waiting outdoors were working actively with the government. We hope that we will be able to identify the additional isolation facilities to improve the situation. We are healthcare workers. We do feel bad about the situation. We would like to find better facilities and locations for patients to wait in. We're exploring all avenues to find a solution. There are residents coming from care homes. They are not infected by COVID-19. We gave them health checks and send them back to the care homes. We also send outreach teams to follow up on their conditions. This is to reduce a chance of infection at hospitals, and at the same time, it will alleviate pressure faced by hospitals. I ask for your understanding. At the same time, we have greatly reduced non-essential services by the extent of 40 to 50%. That includes non-essential services, scheduled checkups. Measures aim to reduce infection at hospitals. Also, starting from today, we will suspend the service allowing husbands to stay in with the husband in the delivery room. We have sufficient medication for the use of our patients. Our experts will continue to monitor the development of these epidemic situation, clinical needs, as well as all the researchers will also refer to the latest data from pharmaceutical companies and research institutions. The HA will also constantly assess the situation to ensure that COVID patients will receive safe and the best medication. We have 120 staff members who are preliminary positives. They were infected in the community or in a domestic setting. There are about 20 staff members who are classified as close contacts. From our admission screening, there are about 20 patients who were picked up as preliminary positive cases. There are about 100 patients in the same ward are classified as close contacts. We're compiling the information, and the information will be released by way of a press release.
Now it's question time. Please introduce yourself before you ask the question. Second row, the lady on the right. Good afternoon. I'm from Phoenix TV. I'd like to ask Dr. Ho 3 questions. Number one, we understand that 12,000 confirmed or preliminary positive patients are waiting. The 7 designated clinics have been up and running today, but there are only 1,000 people who can be served. I think you are not meeting demand. How can you boost the capacity? Number two, for people who are staying at home, but they have been confirmed, how can they help themselves? What kind of medication would you propose that they take? Or will you dispatch medication kits for them or even guidelines for them? And number three, elderly people and children, they are getting infected and dying. The situation is quite worrying. About these two groups of people, would there be dedicated arrangements for their isolation and treatment? Will you be opening centers for them, for these two groups of people with dedicated staff? We understand that thousands of patients who are confirmed or preliminary positive are waiting to be hospitalized or to be sent to a community isolation facility. This is not an ideal situation. And therefore, together with government, we are thinking of setting up more isolation facilities in order to shorten their waiting time. And for designated clinics, we have activated them only today. We have received 700 odd bookings. We are going to monitor the usage situation so we can help patients with symptoms so they are helped. You mentioned the elderly and children. We are paying special attention to these groups. If they have serious symptoms, these two groups of people will be given priority for hospitalization. But if they only have mild symptoms, we propose that they go to designated clinics where they can have treatment and medication given to them. While they wait at home, we have actually given infection control advice. Now, for really young children and the elderly, if they have a low fever, we would propose that they take their temperature every 4 hours. Children should be monitored by their parents, who should take down the meals taken and also the number of toilet visits by children. And especially for very young children, please pay particular attention when they have high fever. But if they are still playing, they are still having fun, then we are not really worried. We hope that we can control the body temperature by, for example, wiping the skin with warm water. But we know that the body temperature can go up and down. It may have the shape of a tidal wave, but then overall speaking, it should go down. However, if the fever stays at 39 degrees, and then even with medication and wiping the skin, if it stays high, then we need to pay very special attention, and parents should be very cautious. The gentleman in blue on the right in the back row. I'm from Now TV. Today, we have more than 10,000 confirmed and preliminary positive cases. How do you assess the situation? Do you think that there is a very rapid decline in the situation? Or is it just because you have boosted your capacity with testing? That's why we see more cases. And also, if the epidemic becomes worse, you are saying that people should be isolated at home, but you have not given any details. Are you still thinking about going down that route? And then about the 3-year-old girl who died, we want to know whether her family members have been infected, because there have been reports saying that this girl had a young brother who had just been born. We'd like to know more about this case. Well, we have 4,000 cases which were confirmed last night, and also 7,000 preliminary positive cases. So the trend is still going up. The basic figure remains high. That is why you see such rapid increases. We are all very worried because there is transmission in the community. We hope that we will all reduce our social activities. There are close contacts of the 3-year-old girl who have been confirmed affected. We know that she had a younger family member who was infected, but then we know that the young boy, the baby, did not get the virus through the mother. We will continue to follow up on the case. Next one, on the right, the lady in white.
Yes. Firstly, what happened to the current hospital capacity in Hong Kong? And secondly, regarding the Caritas Medical Center in Shamshui-Po, patients are seen outside the car park area with some waiting at tents and lying in beds. Are they all confirmed with COVID? And what is the hospital authority going to do with these patients? And how many people in the community right now with positive COVID testing result are waiting to be admitted to the hospitals? Thank you.
For the utilization of isolation facilities, and it's already over 90%. That means already reached a limit because we don't expect 100% utilization. With understanding, we need to clean up and turn around time and also admission screening. We observed that some patients are waiting outdoor. This is far from satisfactory. So we also feel very sorry for letting the elderly waiting in outside in such a unfavorable condition. And that's why we are also try to explore different waiting area for them. For the RCHE, residential home elderly, for those who attended A&E and at the same time because of non-COVID reasons, after the initial assessment, and if we find them are stable, we will transfer them and let them rest and back to the RCHE. And at the same time, we will arrange the CGAT team, which is a community outreach team to reassess the patient. Hope these measures can decrease the congestion in the hospital and also decrease the risk of infection, nosocomial infection in the hospital. This at the same time can alleviate the congestion in the hospital.
Okay.
Next one, we can have another English question.
Good afternoon. Some English questions from the South China Morning Post. The city is still quite in shock about the death of a 3-year-old girl. Can the health authorities explain if her death is directly a result of COVID, and will her case be referred to the coroner's court? As of now, how many children under 5 are infected with COVID-19? Do you have a grasp of the numbers and what are their conditions? And also for the 3-year-old girl, are her parents vaccinated, and how many of her close contacts have also been infected? Right now, there's a lot of cases waiting to be admitted to hospital or to be sent to isolation. Can you explain a bit about the triage system at the moment? Is the hospital authority prioritizing children, the elderly, and those with comorbidity to be placed in first in line?
For the triage mechanism, those symptomatic extreme of age, we will usually arrange admission first.
Next question. The reporter in the middle, in beige. I'm from cable TV. We've received information from readers about the condition at Penny's Bay. Some confirmed cases that are under isolation there could not get little files for deep throat saliva test. And you just said that you are trying your best to find additional isolation facilities. But those staying at Penny's Bay, could not get tested every day to monitor the situation. How can you find additional facilities for those in need? And what is your view about that? In relation to designated clinics, you said that for the 7 clinics, there are about 1,000 places, and so far there are about 700 appointments, so there is still spare capacity. We've received from confirmed patients that they could not by phone get through to the service. So about preliminary cases and confirmed cases, they can make an appointment at these clinics, or it depends on the severity of their symptoms. Regarding Penny's Bay, we are in charge of manning and providing services at the medical station. In relation to distribution of deep throat saliva bottles, will liaise with the relevant party. Today is the first day when these designated clinics are commissioned. We have so far received about 700 appointments. We'll monitor the utilization rate and make adjustments. I would like to mention that there are different services available. There is a dedicated hotline. If you don't really have a symptom but you have questions to ask, you may call get the advice they need from the hotline, then they don't need to go to the designated clinics. For these designated clinics, they are for patients who have received notifications that they are confirmed to have been infected with COVID-19. Sorry, speaker's off mic. The speaker is not coming through. If it's someone who is a confirmed case, then they can go to the designated clinics. The designated clinics are for people who have been confirmed with an infection and who cannot go to a hospital yet. For those who have questions but they are asymptomatic, they can call the hotline. So the clinics are for people who have symptoms so that they can seek medical consultation. Next question. I'm from AM 730. Do you have a ratio of staff members who have been infected or who are under quarantine and cannot go to work? At the sampling stations, would they be given test kits? If not, when they go back to hospitals to work, then there will be risks. And in relation to 30 cases of preliminary cases in Qinghou Estate, can you give us more information? Say, for example, the distribution of cases. We'd like to know about the age range of patients who are in critical conditions and those who are in critical condition or who have passed away. What strain of the virus? Can you give us more information about the 37-year-old male patient? Can you give us more information? Say, for example, any chronic illnesses. Currently, there are 120 staff members who are preliminary positive cases. I don't have an accumulated figure. For those who are deployed to take care of COVID patients, there will be fit tests, respirators, and anti-infection control measures put in place before they are deployed. In relation to rapid tests, all our staff members will undergo the rapid tests. It is to be done step by step. For the 37-year-old patient, he suffered from chronic illness and is under care. I don't have any detailed information about distribution of cases in the different blocks. But if we find a large number of cases, the usual approach is compulsory testing and lockdown for continuously, hoping to identify all the cases. Sorry, speakers off mic. Well, there is privacy issue here, but it's someone who needs continuous care, who is chronically ill. In relation to the age range of those who are in a critical condition, most of them are elderly patients. They are all over the age of 58. The gentleman over there. I'm from Oriental Daily News. We heard that, the 44 designated hotels will be converted into isolation centers. Is it true? Do you have the list? When will be the first day when the rooms are available? Who will foot the bill? The government or close contacts? And I'd like to also ask about the designated taxi fleet transporting patients with mild symptoms to relevant facilities. Can you give us more details about the fleet and how is an arrangement made to get the service? We see that there are signs that our healthcare system is on the brink of collapse. So can you give us more information about how you deal with Delta patients at the moment? In relation to the clinical conditions, we refer to the indices. So we can't tell by the look of the patient that is whether it's a Delta case. So we look at whether the person is lackluster, whether there are any symptoms. So it's about the overall appearance and the condition of the patient. I don't have any further information in relation to additional isolation facilities. The transportation questions will have to be answered by other government departments.
They have any other underlying conditions in addition to COVID, and also Professor Lau Yulong, who's also a government panel advisor, he told a RTHK program that children could be more prone to severe illness from COVID due to reasons such as lack of vaccinations and also disruptions to school and daily lives in the past 2 years mean that they've had less exposure to other human coronaviruses, so their immune systems are not as equipped to fight off COVID. And lastly, because children are small and they could be weaker. So is that something that the CHP agrees with? And considering evidence from around the world where it seems like children should not be as susceptible to COVID, does that mean that we could be seeing a new trend in Hong Kong? Thank you.
I understand the government is overall assessing the overall situation of the pandemic situation in Hong Kong and the isolation facilities, etc. So I think if there is any change in the policy, they will announce as soon as possible.
but I do not have any details at the moment. We rely on the experts, especially the pediatricians and the immunologists, to assess the situation of the children, whether there's any. We respect their opinions and comments. We do not have any further comments on that.
下一題。
Next question. The gentleman in white. I'm from TVB. First of all, about the elderly homes in Shamshui-Po. I'd like to know how many people are infected. Is it that they have been through the rapid test only? Will you be arranging nucleic tests for them? Do you think that in that particular hostel, there is already an outbreak? Dr. Chuang, you said that there are 20 centers which are seeing infections. How do you decide whether they should be isolated there then or that they should be sent to isolation facilities? And what about people who are staying at home? What kind of advice can you give them if they have already recovered, and should they go to a testing center to be confirmed? And I'd like to know if there is a pregnant lady who is in the ICU of Queen Elizabeth Hospital. How is she now? About the Society of Boys Centers, the center in Shamshui-Po, we know that there are preliminary positive cases, and we are following up the case with the person in charge. The AWE facility is now being used by elderly people, and in fact, it is not intended for young children. In fact, it is really for old people and people with disabilities. So the people from the Chet Yen Center School of Society of Boys Centers should be sent to hospital. But now they are being isolated on the ground floor level of the facility. I understand that many children now actually do not have symptoms. And on the second floor, there are about 8 to 10 persons who are close contacts, and they are being quarantined there. They should be able to get vials for testing. But we'll see how the arrangement will be made. As for people who have stayed in the community and who are confirmed cases or preliminary confirmed cases, should they be hospitalized or should they go to a community isolation center? The HA is still taking this up with ourselves and also the Food and Health Bureau. Sorry, the report is not coming through. This is being discussed. Next one. As for the pregnant woman, I don't have information about this. I'm still looking into it. Next one. The one in the cream top at the front. Good afternoon. I'm from Mingpao. I'd like to ask how many confirmed and preliminary positive patients are still in the community? Is it really that 12,000 are still waiting? And also, I'd like to ask about Penny's Bay, the AWE, and also the temporary hospitals. What is the usage rate? And actually, people are recovering while they wait in the community. You said that there will be a standard to decide whether people have recovered. Are you working on them? When will they be available? And lastly, about medication. I'd like to know whether you still have sufficient stock. Will you have to make another purchase? Is it that the medication remdesivir, should it be for people who have symptoms that are getting worse? Is it that the guidelines are being tightened up? As for MSD and Pfizer, when will those medications be available, and how are they different from remdesivir? I'd like to correct myself. Actually, the younger brother of the 3-year-old girl who died is not infected. And also, our experts are looking at scientific evidence in order to adjust the guidelines from time to time. Now that we understand the virus better, we are adjusting medication at the clinical level. What about remdesivir? Do you have enough stock? And about people who are waiting to be hospitalized, what is your advice for them? Sorry, the speaker is not using a microphone. About the medication issue, we knew that patients have all the medication they need. As for the different isolation facilities, we are using up to 90% already. As for how many confirmed patients are in the community, we know that there are thousands. We are still trying to tidy up the figures. Next one. I'm from Hong Kong 01. There are 17 patients who are in critical condition. Are there any children among them? And also, which variant has the 3-year-old girl who died been infected with? She did not suffer from any serious diseases. Why did she die so suddenly? And also, the 100-year-old female patient who died last night, what kind of variant was she infected with? What about the 37 male patient? And also, we understand that a confirmed patient went to the designated clinic today, but then he or she took a bus on his or her way home. Do you think that that will increase the risk of infection? Let me see. Amongst the people with critical condition, the age range is from 45 to 91. There are no children among them. As for the 3-year-old girl, she has no chronic diseases. The disease onset was really fast, and the variant was Omicron. Therefore, I would appeal to children if they are over 3 years old, and so they are eligible for vaccination. We appeal to parents to take them to be vaccinated, because figures are telling us that vaccination does help to reduce the risk of serious complications and also the need for hospitalization and also death. I hope you will take your children to be vaccinated. Next one. On the back row, the lady in purple. I'm from Dot News or Dot News. Yesterday, there were 1,000 cases. Now, today, 4,000 cases. Is that a result of the boosted testing capacity? Secondly, we know of many cases that while the whole family wait for testing, family members have been infected. And then they will get the result only a few days later. Does it mean that they should again do the deep throat saliva test and then wait again? The serious backlog of cases, would there be an impact on the distribution of medical resources?
We had 1,600 confirmed cases and 5,400 preliminary positive cases. Of the latter amount, 4,300 of them were confirmed, and about 1,000 cases or so that are still being processed. We still have about 7,000 cases. So the trend is an increasing number of cases. I believe that private laboratories are still under tremendous pressure on their testing capacity, there may be some delay. And of course, if it is a positive case, that there will be double checking in terms of testing. The lady at the front. I'm from In Media. We've heard from members of the public that there is a construction site with at least 30 people who have been affected. And a few days ago, the definition of close contacts have been revised. The construction workers told us that they have worked with the preliminary positive cases and there were masks taken off. However, he was not classified as a close contact and the work at the construction site continued. Are you concerned that the revised definition of close contacts would result in an increasing number of hidden carriers in the community? In relation to testing of L542R, there are a number of samples that have not been confirmed yet. Does it mean that you don't know whether they're Delta or Omicron? And in relation to so what impact does it have in relation to the spread in the community? Which construction site are you talking about? T2, you mean the one at the airport? Usually we will require the site to suspend work for disinfection, and if there are close contacts, we would advise them not to go to work. For hospitals, they will do genome sequencing. That's why they will not do a virus analysis for L542R. But for CHP, we will continue to do that. It is impossible to know every case there are in the community. So well, if we can differentiate the number of cases between Delta and Omicron, it gives us an idea of the general situation in the community. We continue with our work in terms of close contact tracing. Well, last night we saw that there are some patients at some hospitals that had to spend the night outdoors. Well, it's been quite cold. Would it have a negative impact on patients? What measures will the HA put in place to do that? And what advice do you give patients before they are admitted? There are a large number of patients waiting to be admitted. They were taken to hospital by ambulances. So the arrangement is for some people to wait outside the hospital. We are aware of the situation. We provide a space blanket for those who are waiting to keep warm. We also send staff members to monitor the situation of patients waiting outside. The current arrangement is not ideal. We'll see if there are other facilities that we can use for patients to wait in. We're talking to the government to identify possible additional isolation facilities for patients to go to. Last question. I'm from Hong Kong Economic Times. I'd like to ask about care homes. How many care homes have more than one case? Are there any care homes that have seen an outbreak? Do you know how many care homes will have to undergo evacuation? I'd like to ask the HA. Yesterday, you said that you were looking into the cases when patients who have recovered at home will not have to be sent to hospital. Any update in relation to the nine cases of death? Have they been vaccinated and when? From the start of the 5th outbreak to now, how many children have been confirmed cases and who are or have been in critical conditions. There are many rapid antigen tests, so they are not defined as preliminary positive cases, and some of them are in care homes. For some of them, they have maybe 1 or 2 or 2 or 3, but there are individual care homes that have got a higher number of cases. For the fatality cases, we know that some of them have not been vaccinated, and for other cases, we don't know yet. I'd like to emphasize that you should get vaccinated because the vaccination will reduce the risk of serious conditions, complications, and risk of fatality. You asked about those who are under the age of 3 who are in a critical condition. There is the case in the Children's Hospital. There is one in Pok Oi Hospital who passed away. And that's these are the cases I can recall. That's the end of the press conference. Thank you. Sorry, speakers off mic. Well, it is rather saturated. It's over 90%. We have used almost all of our capacity.